I begin with the name of Allah Almighty, the most merciful, the most gracious. Assalamu alaikum. To start this beautiful morning, I would like to invite Dr. Athar Mukhtar Siddiqui for recitation of Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الذي خلقني فهو يهدين والذي هو يطعمني ويسقين وإذا مرضت فهو يشفين والذي يميتني ثم يحيين صدق الله العظيم. I recited 4 small verses of Surah Ash-Shura, which is the 26th chapter of Quran, and it says that it is my Lord Allah who created me and He guides me. It is He who gives me to sustain, to eat and drink. It is He who make me sick, and it is He who heals me. And He makes me to die and then resurrects me. Sadaqallahu al-Azim.
Jazakallah khairan kaseera. Warm greetings for the day, ladies and gentlemen. Please rise and kindly remain standing for the national anthem. Thank you very much. I, Dr. Sadaf Mushtaq, welcome you all. Firstly, I would like to thank you, the experts, our national and international faculty members, for taking out their precious time and making to this event. Secondly, I would like to thank you, my audience, for being present here today. It gives me a great pleasure to extend to you all a very warm welcome on behalf of STSP Lahore chapter. STSP is focused on training, education, collaboration, pain advocacy, and community awareness in the field of healthcare. STSP has the honor to be a member of IASP for the past many years, International Association for the Study of Pain. IASP is the leading global organization supporting the study and practice of pain and pain relief. IASP brings together scientists, clinicians, healthcare providers, and policymakers from all over the world in the pursuit of their mission to bring pain relief to those who are in pain. On having an association with IASP for the study, STSP contributes to global efforts in pain relief through education and professional training programs. Since 2015, STSP is organizing conferences. First two conferences were in fact held in Islamabad in 2015 and 2018. Third Paincon was organized by STSP Karachi chapter, and now for the very first time, Lahore, the heart of Pakistan, the Paris of Pakistan, the city of gardens, is hosting this mega event. Firstly, I would request Professor Dr. Khalid Bashir to please come up for welcome remarks. Professor Dr. Khalid Bashir is President STSP Punjab. He was the first person to start pain management services in Lahore, Pakistan. He was the member of Committee for Development of Curriculum for FCSP Pain Medicine. He has been the Dean of Faculty of Anesthesiology, CPSP. Currently, he is the member of Committee of Pain Medicine, CPSP, and he is also a supervisor and examiner. Please welcome Professor Dr. Khalid Bashir.
Thank you, Dr. Sadaf. Bismillahirrahmanirrahim. It is indeed an honor and pleasure for me to welcome you all at this mega event, which is Paincon4. It is fourth in the sequence. Now, the organization of such conferences have certain objectives and outcomes. You know, we can share the knowledge, we can share the skills, we can share our experiences, we can share the challenges and barriers, especially the persons who have come from all the way from abroad. We can share their experiences. We can collaborate and exchange our training program with them. And for this, I will request the honorable guest of honor, Dr. Mary Cordoza, who is president of IESP, to collaborate with our teaching program so that our trainings we can exchange our trainees to uplift the pain medicine. Now, if you see the pain, every one of us suffer pain from time to time. Acute pain is a symptom, whereas when it becomes chronic, it is a disease, which is very difficult to treat. If you see the statistics of pain, about 15 to 50% patients are suffering from chronic pain. And if you see cancer patients, 60 to 90% patients, they have cancer pain at the end of their life. And even if they survive, still 33% patient suffer from pain. So they look at the misery of these patients. They are waiting for their death in a miserable condition. So where it is pain centers or pain medicine which gives them some relief. Now, pain has certain impact on the quality of life, economical, social impact. So, considering these miseries of patients and suffering of patients, the CPSP has recognized the importance of pain medicine, and they have started FCPS pain medicine as the second specialty of anesthesiology in Pakistan. We are grateful to them. Similarly, there are 8 training institutes in Pakistan for pain medicine, 4 in Lahore, 1 in Karachi, 1 in Hyderabad, and 1 in Islamabad and Multan. We are really grateful to the Dr. Mary Cordoza, who is President-elect of IESP, and we hope that you all will enjoy this trip to Pakistan. And I must pay tribute or compliment to the delegates who have come all the way from Pakistan and abroad, from USA, UK, Ireland, Scotland, UAE, Saudi Arabia, Canada. I hope I have not missed anything. So at the end, I will acknowledge the hard work of organizing committee, especially Dr. Atiq and Dr. Almaz, who have done excellent work. And of course, the sponsors of the conference. I wish you all the best. Best luck. Thank you very much. Dr. Salim, who is pillar of pain medicine in Pakistan, he started pain medicine. Dr. Kiani will tell in detail. Dr. Dr. Salim is not well. He has sent a message.
So Brigadier Mohammed Salim, patron STSP, he is with us.
बिस्मिल्लाहिर्रहमानिर्रहीम। मैं रावलपिंडी से ब्रिगेडियर मोहम्मद सलीम बोल रहा हूँ। मैंने ज़रूर आपकी कॉन्फ्रेंस में आना था। I wish I could come, but due to my age and this stage, it is very difficult to move out of Rawalpindi. मेरी सारी दुआएं, my all prayers are with you. I wish that this will be a very successful conference. I wish all the delegates who have come abroad and locally also, wish them a very good luck. Have a nice trip and have good day with you. Thank you.
Now I will request Brigadier Retired Dr. Asif Kulkarni to please come and share your views on pain medicine specialty outlook in Pakistan. Dr. Asif Kulkarni is the president of STSP Pakistan. He is the consultant anesthetist and pain medicine at Behria International Hospital, Rawalpindi. He is a supervisor of FCPS Pain Medicine and member of CPSP. He is a regular speaker at national and international forums, and he has organized multiple local and international workshops. Please welcome Brigadier Dr. Asif Kulkarni.
Thank you so much for the introduction. Ladies and gentlemen, good morning and assalamu alaikum. So talking of pain medicine in Pakistan, so whenever it's actually a story of about 50 years, and I just have to minimize it to in a time of about 10 minutes for me, which is a lot allocated to me. And whenever we talk of pain in Pakistan, so the first name which would never be forgotten, which has to be mentioned, is Brigadier Salim Saab. We have just listened to his message, and he was the first one to talk about a pain medicine. Pain medicine is still one of the newest disciplines of medicine and worldwide. But he actually, Brigadier Salim Saab, he introduced this concept in the highest teaching hospital of Pakistan, which is in Pakistan Army, and as well as in Pakistan. He gave this concept. And then we can say that he is the John Bonica of Pakistan. So, but he then slowly, gradually, he developed a community, and if he wanted to go a long way, not just a short gains. So the first thing was to inspire people and take more and more people along. And then when people started coming for this concept, the first challenge was to develop a qualification, because there is a lot of quackery going around this concept of pain medicine. And there are different people and different faith healers and the hakims and homeopathy and so manipulators and so different type of thing. So first, the qualification was MSc Pain Medicine, Rifaj University, 2005. Dr. Salman Salim and myself, we were the first batch students of that. And Aga Khan University started a fellowship program, I think 2005. And since that, this is every year they take few fellows, and this is a continued fellowship program. Then in 2014, we were able to develop a curriculum and convince the Council of College of Physicians and Surgeons to introduce the Fellowship of Pain Medicine, which is FCPS Pain Medicine. That was 2014. And now few other, this actually pain medicine, the MSc Pain Medicine is a distant learning program. And now we have another run by university. There are other two universities, Rawalpindi Institute of, Rifa International University and Rawalpindi Medical University. They have started another program for the last about 2 years, which is, this is again a distant learning program. Personally, I am and few of other, we are not very convinced that we should have interventional, distant learning interventional programs, but still, as long as it makes more and more people aware about this pain concept, we have to go with it. About talking in detail about FCPS Pain Medicine, it's a 2 years fellowship program since 2014, as we know, a comprehensive curriculum with strong interventional component and extra departmental rotations to relevant departments, which includes rehab, radiology, and orthopedic psychology, psychiatry, and different other. So it's a dynamic curriculum, and we keep on reviewing this curriculum. And first one was published in 2014, now 2022, and it's still under revision. There is a concept of workplace-based assessment, which is an essential component of our curriculum. And then we have directly observed procedural skills, TOPS, and mini CX. And final assessment is through MCQ papers, TOEICs, long case, and vivos. Now, we have about 14 centers which are now accredited by the College of Physicians and Surgeons for training in FCPS pain medicine. So I'm revising. We have 4 in Islamabad and Rawalpindi. One is CMH, Shifa International Hospital, Fauji Foundation, Bahria International Hospital is also now included. In Lahore, we have 5, I think, 4 or 5. And one is in Multan. That is the only public sector hospital. Rest, most of the time, most of it is this is the only public sector NMU, and the other are either private or semi-government organizations. So there is a tradition of developing pain clinics. Brigadier Slim started it. That was the first one was in Army Medical College in Rawalpindi in 1979. And then he again established a pain clinic in CMH Kharia. CMH means Combined Military Hospital. So similarly, pain clinic at Peshawar, Lahore. At Peshawar, General Amjad established a pain clinic. Then he established a pain clinic in Lahore and Quetta between 1994 and 2006. And then a pain clinic in Aga Khan University Hospital by Dr. Gaurav Shah, 1998. And I started one at the CMH Ahmedabad, 1999. And similarly, we had other civil hospital, Dr. Safia, and in Mayo Hospital, Lahore, by Dr. Jamil Sabit. Then there were interventional workshops. The first one of any mention was in 2000, Ayub Medical College, Ahmedabad, 2003 in Multan, and Liaquat Medical College, Jamshoro, that followed. And then we have a series of workshops in different areas of Pakistan. And the first, in 2006, we had a live workshop in which it was displayed by audiovisual support through on patients. And we had experts from USA and Pakistan also. Free pain clinics is another concept. STSP is constantly extending its, these are our outreach programs, and we go to the distant areas and offer free of cost treatment to bulk of patients. And it's just wherever there is a pain camp, it is advertised few days before the camp, and then a lot of people, they gather, and then there is a group of doctors who, I think this concept is different from IASP, so I'm going into a little detail. We have almost all the remote areas and the distant areas, we have we can extend our programs to that. Then we had a tradition of pain symposia. All Society of Anesthesia conferences had a component of pain sessions, which were symposium, and then we had symposia as such for quite some time. There is a Aga Khan University Hospital is, I think, to my rough estimate, is for about 25 years, they are regularly having a pain symposium, annual symposium. And recently there were in Lahore at Shaukat Khana Memorial Hospital, there were very nice international symposia arranged by Dr. Atiq. This was the first conference, which you can say it was a pure pain conference. In 2004, it was in Karachi, and this was the first concept that just having a conference on pain management. Then we had the first Paincon, which is pain conference. That was in Rawalpindi, Islamabad, and that was 2015. Then this was Paincon 2, 2018, again at Islamabad. Paincon 3, because of COVID, it was more of a virtual activity. Went very well. Very good quality papers were shared. And now we are in Paincon4. So this is the way that a community grows, and we have, mashallah, we have grown very well now, and but still it's an uphill task. The salmon and the trout fish, they swim uphill, up the stream, and it's just the idea is to reproduce. They go upstream to reproduce. So the upstream journey is there. We still have our challenges, like although it's a well-established specialty in Pakistan, the community is highly stable, vibrant, and a progressive species, but it's replicating pretty fast, but still swimming upstream. We have to convince the politicians, the administrators, the managers to accept that pain relief is a basic human right. The comprehensive pain management centers should be established in public sector teaching hospitals. Job creations, job structure, service structure, training of doctors and paramedics, that should be at the government level, at the ministry level. It should be accepted that we have to create jobs for the nurses, for the paramedics, for the doctors, for the specialists. Acute pain service, we still wish, and we're trying that it should be a facility for all the teaching hospitals as well as the district headquarter hospitals. The chronic and cancer pain clinics, centers for teaching hospitals, we wish that we should be able to establish this sort of setup. The quality assurance is a problem. We need quality assurance in teaching, training, and clinical practices. Clinical practice guidelines conforming to local requirements and sources. This is one of our challenge, our target, and we are working on it. And in collaboration with College of Physician and Surgeon, Society for Treatment and Study of Pain, and CPSP, we are working on this, that we should have joint guidelines for according to our own resources and our own issues. Handling the issue of non-availability of drugs for pain relief in chronic, that's a big problem because we have a lot of opioids on the street in Pakistan, but not for medicinal use. That's one of the most difficult things to have. Morphine is not available. Then we have these patches for fentanyl patches are not available. All these things, it's a problem. And then equipment, which is for chronic pain and cancer pain, it's very expensive, and that is one of the challenges. How can we make a low cost or a economical equipment available? So now, but although the waters are much calmer now, and than 4 decades or maybe 5 decades ago, but we still have to swim upstream. The struggle is on. We have to survive and propagate as a species of high quality pain physicians. Society definitely needs us as pain management specialists, but would love us if we can skillfully relieve the agony in a humane and emphatic manner. Thank you so much.
Thank you so much, sir. Now I would like to request Dr. Almas Iqbal to please come up and share the brief introduction of Paincon4. Dr. Almas Iqbal is a British-trained consultant anesthesiologist and pain specialist. She is an expert in performing advanced anesthesia and pain management procedures with a vast experience of working in well-reputed hospitals for the past 20 years. She is currently working as anesthetist at Shaukat Khana Memorial Cancer Hospital and Research Center, Lahore, Pakistan. Please welcome Dr. Almas Iqbal.
Welcome to Paincon4. We are thankful to our delegates and the faculty from across the globe and across Pakistan. It's the diversity that enriches our educational programs. Paincon4 started long way back with pre-conference workshops which were held in different hospitals of different cities across Pakistan. These workshops catered to the pain physicians and for the pain nurses. It generated a huge response in form of 50+ abstracts and posters that we had. We will have a poster and free paper competition and presentation session post-lunch across the hallway in the other hall, in this hall. The program that we have is it's a 2-day conference with 8 sessions, including a panel discussion on cancer pain management. I hope that the various topics that these sessions are covering is of interest to our audience, and we look forward to the feedback that you give on the conference. Intellectually stimulating 2 days of conference is ahead of you. Enjoy. Thank you.
It is a great honor to invite our esteemed chief guest, Dr. Mary Soma Cardosa. Dr. Cardosa has been actively involved in teaching and developing pain management in Malaysia and in the Asian region for the past many decades. She was president of Malaysian Association for the Study of Pain for 10 years and now serves as advisor to the MASP. She also served as council member in IASP for 6 years and is currently the president-elect of IASP. Please welcome Dr. Cardosa.
Thank you very much. Good morning, everybody. This is a surprise to me that I'm supposed to say something, but I'm very happy to be here. Thank you to all the organizers for inviting me to be part of your Paincon4. And congratulations for organizing this conference. So on behalf of IASP, I would like to convey the congratulations from the organization, and I think Pakistan STSP, Society for the Treatment and Study of Pain, is one of the important chapters of IASP, and also part of SAPS, the South Asian Regional Pain Association, which includes all the other pain societies in this region as well. So I think everything has been said earlier, and I think that what the previous speakers have talked about in terms of the philosophy, the approach, what we are trying to promote, so it's in line with IASP. So IASP, our logo, is working together for pain relief throughout the world. And I think that I just want to say that the unique thing about IASP, which we hope is actually reproduced in all our chapters, is that it brings together both scientists, basic scientists, as well as clinicians who are all working on pain. So the scientists work on the animal models, the molecular, whatnot. And then importantly, this has to be translated into clinical practice. And coming together with between the clinicians and the scientists, I think is very powerful, because we each influence each other as well as inspire each other, I think, to work in this area. And even for clinicians, IASP hopes that we are not just doctors, but we also have physiotherapists, psychologists, nurses, and all the other allied health personnel to work together in a team. So I will be talking more about working together in multidisciplinary teams later in my talk. But I just wanted to say that this is the philosophy that IASP is promoting, and I can see that the challenges, pain medicine has developed a lot in Pakistan, but the challenge, as you say, we are still swimming upstream, and I think the challenge is for us to form these multidisciplinary or interdisciplinary pain management teams so that we can help patients with pain, whether it's acute, chronic, or cancer pain, to manage their pain better. So with that, I would like to declare open. I'm supposed to declare this Paincon4 open.
Thank you so much, ma'am. It's a great honor to have you. Now we have some special surprise announcement. I'll request Dr. Salman Salim to please come up for the special surprise announcement. He is the General Secretary of STSP, Pakistan.
Assalamu alaikum. Thank you, Sadaf. On behalf of Society for Treatment and Study of Pain, Pakistan, I am pleased to announce 2 awards in recognition of invaluable contributions in pain medicine. The first award is Salim's Gold Medal, being presented to Major General Amjad Iqbal. President को भी बुला. I would request President STSP Dr. Asif Kiani to come on the stage to give this award with President IASP to Major General Amjad Iqbal. A brief introduction of Major General Amjad Iqbal is, he is a graduate of Army Medical College, did his MCPS, FCPS in anesthesia. Then he went to UK for advanced training in pain medicine. He worked in Pain Research Institute, Liverpool in 1995 and 96. In 2016, he was appointed advisor in anesthesia, ICU and pain medicine in Pakistan Army. He was awarded Hilal-e-Imtiaz military in 2017 in recognition of his meritorious services in Pakistan Army. In 2022, he was awarded Lifetime Achievement Award by Aga Khan University Hospital, Karachi. He is author of more than 15 national and international papers. General Amjad is among the pioneers of pain medicine in Pakistan. He played an instrumental role in starting FCPS pain medicine. He established first FCPS recognized center in CMH Rawalpindi, and he was also first supervisor of FCPS pain medicine in Pakistan. Currently, he is working as honorary visiting professor at Rawalpindi Medical University and contributing CPSP as examiner and as member of faculty of pain medicine. I request Brigadier Asif Kiani and our IASP president to give this medal to General Amjad Iqbal. The next award is Lifetime Achievement Award, is for Professor Khalid Bashir. This is given to his marvelous contributions in pain medicine in Punjab and in all Pakistan. Dr. Sadaf has introduced him in detail. मेरे ख्याल में किसी तारीफ के मोहताज नहीं है प्रोफेसर खालिद. Thank you.
Thank you so much, sir. Now, to conclude this inaugural ceremony, I would like to request Professor Dr. Alina Aziz. She is the Vice President, STSP Lahore Chapter, and she'll be coming for a vote of thanks.
Bismillahirrahmanirrahim. Thank you very much for gracing this occasion and making it a worthwhile occasion. And I would like to thank all the participants from the north to south, east and west of our own country, and from the interior, especially from Nawab Shah and all distant places of Pakistan. And a very special thanks to our overseas participants, namely Dr. Mary Cardosa, Dr. Claire Rocks, Michelle Serpil, Dr. Ellen Baker, Dr. Muhajir Baloch, Dr. Junaid Khan, Dr. Wajid Mahmood, Dr. Usman Bashir, Dr. Atif Ali. Our very special thanks to our promoters in the pharmaceuticals, the Sami farmers, the B Bronze, the Akai Pharma, the Cereal Pharma, the Nutri Farmers, the Wilson's Pharma, the Noor International, the Bosch Pharma, and the Brooks Pharma. Thank you, all of you. You made it a huge difference. Thank you very much again.
Thank you so much, ma'am. Now it's time for a short tea break, and we'll meet here again at 10:30 a.m. sharp for state-of-the-art lecture by ISP President Dr. Cardosa. So please be here by 10:30 a.m. Thank you so much.